And welcome to this visual lecture answering the question, what is the single most important thing we can do to manage our stress? A few years ago, we moved our family to France for 3 months. It was the time of the European Cup football championships, and so we would take our kids to the local bar to watch the game on TV. Watching the moods of people from different countries swing from pure joy to total anxiety to despair and back again was as entertaining as the game itself. And I wondered if there was any scientific analysis of how this kind of stress affects people. And it turns out there has been a study. In the quarterfinal of the 1996 championships between the French and Dutch teams, a draw at the end of overtime resulted in a sudden death penalty shootout, which was won by the French. When researchers looked back to see if there were health changes on that day, it turned out there was a relative increase in the risk of death from a heart attack by about 50% among the Dutch men on the day of the match compared with the 5 days on either side of the match. There was no such effect on French men, or women from either country for that matter. So this story is striking because it's about one event and really one negative health outcome of stress. But in reality, stress is very complex, multiple factors and multiple outcomes. The physiologist sees stress as increased blood pressure, heart rate, or changes in the chemicals that modulate the immune system. The social worker sees vulnerability, with compromised social networks, coping, and problem-solving skills. The doctor sees increased visits. It's estimated that up to 70% of primary care visits are stress-related. Worse health outcomes, bad self-treatment with alcohol and drugs, gateways to depression and anxiety, and of course a worse quality of life. These perspectives represent the standard negative picture of stress, but I believe we also see a positive side to stress. Athletes who are able to find a stress level that is high, but not too high for optimum performance. Executives or mothers or aid workers who manage stress like a bicycle tire. They regulate enough pressure to keep rolling, but not too much so that if they hit a bump, they explode. And to me, this is really the most interesting question when we look at stress and health. How do some people undergoing intense stress remain healthy and even thrive, and what makes them stress resistant?